Perfect. Yeah, I think you described it well. Like our main idea is always interesting to present as public, but for us, the possibilities of what we can do is for us is very interesting. So we work in the medical malpractice space, and we use artificial intelligence to make this process more efficient. Basically, leading with claims, understanding what could be a medical mistake, understanding exposure. And the reason we work on this space is because there's a lot of inefficiency in this space. There's no data. It's difficult to find attorneys, whether you're a plaintiff or an insurance company. You choose the attorney not based on historical performance, but more on who you know and who you feel like is the right patient. And the process of discovery is very inefficient. So we end up with 20% of claims that should not receive awards, and 40% of claims that actually have merits don't receive awards. So it's a very inefficient space, and that's why all of us distrust the medical malpractice space. So what we built is an AI platform that allows us to do three things. We can understand very quickly the likelihood of a medical malpractice claim winning in court and how much it's likely to win. We can understand which are the best law firms, and forgive for the typo here, which are the best law firms and medical expert witness that can handle this case. And we can also detect future medical malpractice lawsuits, and then we can find ways to prevent them. And the way that we're currently using this is actually on, I think that's why Alex mentioned our use case. The ones who were quickest to adopt our technology were the plaintiff attorneys. So we've been talking to insurance companies, and they move very slowly. And now we're talking again to hospitals because they tend to move a little faster. But plaintiff attorneys have been adopting technology fast. So quickly, what we do for them is that we understand which plaintiffs are likely to bring lawsuits, and we can match them with the attorneys. And we end up taking a percentage of the case. So this is our current revenue projection. So our product has been going super fast with the plaintiff side, has been growing 16% month over month. And we acquired right now, we have over 2 million that we received for these cases. And we do that very, very efficiently. We acquired this 2 million. Our goal is to get to 4 million this product within the next 6 months, 20 million by the end of next year, and keep growing. And we do this very efficiently. We have an LTV over CAC of over 5, meaning that whatever we spend, we get 5x on revenue for ourselves. And this is an interesting, big space. We can keep optimizing the plaintiff side and making them more efficient. The market size is big. But my main interest in talking here is because my background is I was a professor at Mount Sinai Hospital. I taught there, I did research. All of our team comes from the defense side, from investors to our CTO, whose parents are doctors. So we're interested in, again, giving a try on the defense side again. On the defense side, we can do the same thing that we do, just like in a more efficient way for the risk management teams. We can understand potential medical mistakes and prevent them. So you proactively deal with them before they become lawsuits against your hospital. And we can understand which is the best expert witness and law firm to deal with this case. So we feel like, the best medical mistake is that medical mistake doesn't happen. And that's something that right now we are interested in doing for the defense side. So our team, very briefly, is myself. As I mentioned, I was a professor at Mount Sinai Hospital. I was an entrepreneur in residence in the Texas Medical Center, working with MD Anderson. I was a fellow at a venture capital firm in New York. Our CTO used to work at Google for 8 years, and he was a Google developer expert, so he is an AI guy. Our COO was a defense attorney for most of his life in medical malpractice, and our chief of marketing was the CMO of the American Kennel Club and in a few different organizations. Also worked in healthcare at RSI's Health. And then what we're looking for right now is that we've raised 1.25 million. 1,250,000. And right now we're closing a round. So we're looking for more 250K. Our lead investor is Vivek Garipalli. So he is the founder of Clover Health, which is a company going public now. Is one of the largest exits in digital health ever. And we have other attorneys in the space, investors in the legal space, and a couple of venture capital firms. So with that, that's basically what we have. So thanks for the time, and thanks for having me.
Thanks, Victor. And that was right on time. I appreciate that. Right, Heather? I think it was exactly at 5. So,
Yeah.
very cool. So, as I said, we're very familiar with the space. Law Cash, is one of our family businesses,
Yeah.
for example.
Are there
Um,
patents on this one? Same sort of question. How's this business protected, or are you
that
just
could be your question
starting the
every time,
network?
Rob. Rob, are you like
Well, it's going to be a common question, yeah, because I like big exits with lots of money.
Yeah, so great question. So we chose not to have patents. We have developed a lot of proprietary algorithms. All the models that we have, including OCR
you're going
for
trade secret?
digitization, are our own models. We chose not to patent after talking to Cooley's our law firm, and we have some good attorneys there. The advice was not to patent, otherwise we're going to give the road of the way. So we keep everything trade secret, and then the moat, because we don't have a patent, is actually the database. We have 300,000 historical claims in medical malpractice, which is one of the largest databases. So it's difficult for other people to build models like ours because they just don't have access to these data sets.
Cool. And you've been talking to the insurance companies too, not just the provider side or the legal side?
Yeah, so we talked to insurance companies. They're interested in using the product. What they want to see is SOC 2 regulation, and we have a few things on the DevOps to develop. And we chose actively right now not to go with insurance companies just because our team is just 9 people now. And then we would have to hire 2 DevOps people just to develop the product for insurance companies. So it's something that we have on the roadmap. It's just that given the growth that we've been seeing with the Plaintiff side, we decided to go on that side first.
Right. Well, they will be interested.
Great job, Victor. This is Paulo. Just wanted curiosity. What are you planning to do with that 250 you're raising?
Yeah, so that's the remaining money that we have. So it's mostly growth. We have to hire 3 people. Right now, we just had 2 people on our sales team, and we just hired 2 more, and we want to hire 2 more and hire someone else on the marketing team. Because right now it's basically the model that we have currently, it's working, and the idea is to keep scaling it. And then we do that, I free up my time a little bit more to focus on the next market. So we want to launch the second product by Q2 of next year, which is matching expert witnesses. It's something that we're not doing just yet. And of course, this demands, collaborations, meetings, and all the kind of stuff that right now we just don't have the time to do.
So I think you guys are going to make a lot of money on this.
Yeah.
The one of the things I can't really talk about is I see a lot of his clinical benefit potential, right? So I was hoping you're going to say, we're going to use our AI machine learning tool to prevent the medical errors. Is that on your roadmap?
Yeah, so that's something that right now we're talking to one hospital system, a big one in Boston, because we can train models to prevent them. And that's basically what we're doing. We're detecting where a mistake happened just in the past, right? After it happened, the mistake already happened. And the way we see this, the best data set in the world to train models to detect medical mistakes, because everyone is looking for medical mistakes, so they're labeled. So for deep learning models is ideal. But then once you detect medical mistakes that happened in the past, you can detect the ones that will happen in the future. And that's definitely where we're going. That's what we see the big vision of the company. We don't see happening realistically within the next 2 years, but we consider ourselves a deep tech company. So this is kind of the deep tech side of it. It's a very challenging problem, but we believe that this data set is the best one for this.
Victor, I'm going to say something very cynical here about that, trying to play both sides of the field here. If I'm a hospital or a health system, and I know that your company makes most of its money off of doing this for litigators and people going after, making malpractice, the last thing I'm going to want to do is let you curate my data and mine it for insights about where medical mistakes happen. And I just want to understand how you think you would make that pitch, because it wouldn't make sense to not use it to make your system smarter. But doesn't that then give a lot of intel to the other side about where to look?
Yeah, that's a great question.
I actually see it's going to be one or the other.
Yeah, it's a question we get often. And I have a few thoughts on this. One of them is there's a few companies playing both sides of the space. Like, Palantir, I think is a controversial one, but they're playing both sides, and sometimes governments, helping different governments that are competing understand their data. But also the medical space itself, like you have medical expert witnesses, in which they actually, if they just play on one side, they're not believed because they're considered to be rigged, and they're always being played by the plaintiff or by the defense. So it's common even in this space. But the main thing is that, the product works and we're optimizing the plaintiff side. And I come from the defense side. All my friends are doctors, I taught in the hospital system. I would love to be able to optimize the hospital system as well. And the idea is to keep the data separate, right? So, what you help for one system, you don't actually help for the other one. And you cannot have conflicting cases, right? So if someone is, you have a case that, you're helping on the plaintiff side, you don't want to do help on the defense side and vice versa. But I just feel like honestly, it's kind of a shame that you can, coming from the defense side, only help the plaintiff side. If we can help work on the defense side and help to prevent mistakes. And then that's why we're talking to insurance companies. So actually a part of an accelerator on the insurance space is an accelerator in Hartford, Connecticut. And their vision is that we can help them on the defense side as much as we're helping on the plaintiff side.
Right.
So
That's
it's,
great. That's 5 minutes. Thank you.
Yeah, thank you.
Great job, Victor. I mean, this was.